Okay, so this is an anatomy site. I don't have an actual case in front of me here, but if you can imagine that this patient is prone, then the way that we decide to place these probes is sort of a simplistic description. So if you look right here, posteriorly, there's always this point, right? So if you keep an eye on that point right there, as you scroll down, that point will become soft and you will have this nice smooth right there. You have this nice smooth obturator internus. Maybe a couple cuts down, it's going to look even better. But the point has gone away and now you're starting to see this nice smooth sort of angulation and softer curve of the obturator internus. And in fact, you can start to see the neurovascular bundle right here where it's going to enter into this canal just deep to the fascia that overlies the obturator internus. So if we keep going down just a little bit more, right about there. So right about here, this cut right here, if you drop these probes, if you're using Boston ice rods, and you leave the tip right there on both sides, right there in the fat, don't try to stab the nerve or crush the nerve. You want to set it in the ischioanal fat adjacent to and medial to what will be the pudendal canal running underneath that fascia. And so this is really the cut. And this is really the extent to which we put them. And then remember that the ice ball, you'll be okay medially. It might go laterally a little bit, but that's okay. And if I go back up, it's going to also extend cranially and it's also going to extend caudally. So this is sort of our determination that you're statistically most likely, in our opinion, to catch the pudendal nerve. If you follow that point, starts to get soft, start to see that nice smooth, bam, right there, that nice smooth contour of the obturator internus. That's the cut where I would put my probe and I would just, right there is the tip and then just let it go right out there parallel to the muscle in the fat medial. You don't want to stab the nerve because that does cause problems. And I have sort of a PowerPoint with a probe placed on that same cut. So that's essentially where you can expect your ablation zone to go. If you can also imagine that it's going to go caudal and cephalad as well. That, in my opinion, is your best bet. Ice rods.